What is coronavirus or COVID-19? According to the WHO, coronaviruses are a large family of viruses that range from the common cold to much more serious diseases. These diseases can infect both humans and animals. The strain that began spreading in Wuhan, the capital of China's Hubei province, is related to two other coronaviruses that have caused major outbreaks in recent years: severe acute respiratory syndrome, SARS, and Middle East respiratory syndrome, MERS. Symptoms of a coronavirus infection range in severity from respiratory problems to cases of pneumonia, kidney failure, and a buildup of fluid in the lungs. They may appear 2 to 14 days after exposure to the virus. The symptoms include a cough, shortness of breath, fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a loss of taste or smell. COVID-19 spreads more easily than SARS and is similar to other coronaviruses that cause cold-like symptoms, experts have said. It appears to be highly transmissible. Public health officials say the novel coronavirus is less deadly than SARS, which killed about 10% of people who were infected during the outbreak that began in 2002. Similar to other respiratory illnesses, older people and those with illnesses such as diabetes and high blood pressure are at increased risk. How does it spread? The coronavirus primarily spreads from person to person, and not easily from a contaminated surface. The CDC said the virus spreads easily and sustainably between people. The agency added that contaminated objects, surfaces, and infected animals do not appear to be significant modes of transmission. The virus travels through the droplets a person produces when talking or coughing. An individual does not need to feel sick or show symptoms to spread it. How should I protect myself? There are some basic precautions you can take, which are the same as what you should be doing every day to stave off other respiratory diseases. You've seen the guidance before. Wash your hands regularly. Cover your nose and mouth when you sneeze. And when you're sick, stay home from work or school and drink lots of fluids. The CDC recommends washing with soap and water for at least 20 seconds after using the bathroom, before eating, and after blowing your nose or sneezing. It also advises not to touch your eyes, nose, and mouth, and to clean objects and surfaces you touch often. Should I see a doctor? It is a good idea to call your primary care doctor if you have both a fever and a cough, experts said. And if you have shortness of breath, unremitting fever, weakness, or lethargy, it's definitely time to get in touch with a healthcare professional, they say. Those could be signs of pneumonia, which is common in severe cases of coronavirus. The Centers for Disease Control and Prevention also recommends that you seek medical help if you recently traveled to a coronavirus-infected area, or had close contact with a known infected person, and have a fever, a cough, or trouble breathing. How can I get tested? If you have mild symptoms, you probably won't be. If you are sick enough to be hospitalized, you'll likely get tested. If you are in the middle group, it's unclear. And even as more tests are being manufactured and shipped around the country, many public health labs receiving them don't have enough staff or equipment to meet the testing need. Some medical centers are offering their own tests, and some primary care doctors are exploring how to administer the tests in their offices, but many are reluctant because it carries risks for their staff and other patients. The guidance makes clear that wearing face coverings or cloth masks is an additional public health measure to prevent the spread of the virus, not a substitute for social distancing. Social distancing of at least 6 feet is still recommended even when wearing a mask. Guidance and internal memos from CDC emphasize that a cloth facial mask is intended not so much to protect the wearer, but to help prevent people who do not know they are infected from spreading of the virus to others. The new CDC guidance was prompted by increasing evidence that infected people without symptoms can spread the coronavirus. Simple cloth masks that cover the mouth and nose can prevent virus transmission from such individuals when they are out buying groceries, where people may come into closer contact. Please give this video a like and leave a comment. Thanks for watching.